The hip is a robust structure designed to withstand great amounts of impact. However, despite its durability, the hip is not indestructible. As I addressed in my previous video, hip pain is particularly common in runners. The precise location of hip pain can provide valuable cues in the underlying cause or problem. However, musculature surrounding the joint works seamlessly together, and therefore any dysfunction within the musculature can affect the whole entire system. Hi there, I'm Liv from the Bod Squad in Norwood, and I have helped loads of patients say goodbye to their back, hip, knee and ankle pain. In today's video, I'm going to go through how muscle dysfunction in the hip can lead to poor movement patterns and pain, particularly in runners. One problem I see and am referring to in this video is overactive hip flexors and adductors and underactive gluteals and abductors. And this is an incredibly common problem these days, particularly due to the increased time spent sitting in our day-to-day lives. The primary role of the gluteals and the abductor muscles, which are the ones that run through your buttock and the side of your thigh, is to stabilize your pelvis, particularly when standing on one leg. And this actually happens every single time we take a step. If you have poor firing through the gluteals and abductor muscles, then the other less efficient muscles within the hip joint take more of the load and impact, and therefore leads to hip pain, particularly in runners. So I'm going to show you one stretch and one strengthening exercises to help improve muscle firing patterns within the hip. So the first exercise is a stretch through the hip flexors, which, as I've just mentioned, are commonly overactive and tight in most individuals. So to get this stretch, you want to go into a half kneeling position. Instead of lunging forward to get a stretch through the back leg, I actually want you to tuck your pelvis under to lengthen all the way from your hip joint down towards your thigh. You can also raise your hands above your head to enhance the stretch going down through that area. The aim is for it to be comfortable enough to hold for about 20 to 30 seconds while still feeling an efficient stretch. Exercise number 2 is a strengthening exercise for the gluteals and abductors, which again, as I've spoken about, are commonly weak. So I want you to lie on your side, keeping your bottom leg bent and your hips staying on top of one another. You're going to raise your leg out to the side away from your body and turn your foot to face the ground to create some external rotation through the hip joint. From there, you're either going to hold it for about 20 to 30 seconds, or alternatively, you can raise your leg up and down while maintaining that alignment through your hips. If you are raising it up and down, the aim is to do about 8 to 10 reps and then have a break. You can repeat this again if you want to do another set. So the good news is that these poor movement and firing patterns within the hip can be corrected with exercises, and when they are, hip pain and problems often dramatically reduce or even disappear. If you have tried these exercises and still having problems with your hip, or if you want some more one-to-one support, I'd love to help you out. You can schedule an appointment by calling the clinic on 8431 9100. Until next time, stay well and we'll see you soon.